An outbreak of dengue fever has been declared in St. Lucia.
These increasing trends now constitute an outbreak. This means that the numbers currently being reported exceed the numbers expected, and as such, warrant an immediate and targeted response.
National epidemiologist Michel Fossois reports that St. Lucia experienced a 174% increase in dengue fever cases from July. September has already seen two-thirds of August's cases, prompting health officials to declare an outbreak.
Prevention and control, therefore, involves the elimination of the Aedes aegypti mosquito. Because the vector requires water to breed, the public is asked to assist in the control of dengue by eliminating breeding sites in and around the homes. The vector is capable of breeding in the smallest of receptacles, so frequent checks around the home is essential to combat the spread of dengue. Persons are also advised to avoid the indiscriminate dumping of garbage, which also serves as a breeding ground for the mosquito. Please adhere to the scheduled garbage collection days and times. If you have been diagnosed with dengue, please sleep under a mosquito net to avoid being bitten by the mosquito. The use of insect repellent is also recommended to control the spread of dengue virus. Repellent may be applied directly to the skin, clothing, or mosquito nets. Together, we can break the transmission cycle.
As of January 1st, St. Lucia recorded 205 dengue cases. 53% of cases were among females aged 15 to 49, while 64% occurred in the northern part of the island. Castries and Grosley accounted for 29% of cases each, with Babono at 11%. Fossois said cases have also been reported in the southern sectors, but to a lesser extent. The female Aedes aegypti mosquito is the culprit behind the disease's spread.
These mosquitoes are also vectors of chikungunya, yellow fever, and Zika viruses. The mosquito lives in urban habitats and breeds mostly in man-made containers. It feeds primarily during the day, with peak biting periods in the early morning and in the evening before sunset. Dengue is widespread throughout the tropics, with local variations in risk influenced by rainfall, temperature, relative humidity, and unplanned rapid urbanization.
Fossois notes that about 75% of dengue infections are asymptomatic or produce a very mild febrile illness. People with mild dengue may present with fever, accompanied by rash, nausea or vomiting, pain behind the eye, muscle and joint pain.
In its more severe form, persons may progress to bleeding from the gums or nose, vomiting blood, and passing blood in the stool. They may also experience severe abdominal pain and/or excessive vomiting, which may lead to dehydration. Approximately 5% of persons progress to the severe form of dengue infection. There is no specific treatment for dengue, and management is supportive based on clinical presentation.
The Ministry of Health pledges continued monitoring of the dengue situation and will provide regular updates. The public is encouraged to stay informed and take the necessary steps to prevent the spread of the disease. Lucia Alfred, HTS News Force.